Avascular necrosis (AVN) is an orthopedic disease. Look at this picture, shows that CT findings, MRI and X-ray findings. The picture shows, look at this, necrosis in hip joint, detail going on. Introduction. Avascular necrosis, also known as osteonecrosis or bone infraction, occurs when the blood supply to a bone is interrupted or reduced, causing the death of bone tissue. If left untreated, it can lead to the collapse of the bone structure, joint dysfunction and severe pain. Definition. Avascular necrosis is a pathological condition characterized by the death of bone tissue due to lack of adequate blood supply. It can affect any bone, but is most commonly seen in the hip, knees, shoulders and ankles. Types. 1. Traumatic AVN occurs due to physical injury to the bone, example fracture. 2. Non-traumatic AVN arise without any obvious injury and is often associated with medical conditions. 3. Idiopathic AVN has no identifiable cause. Causes. 1. Trauma, bone fracture or joint dislocation can damage blood vessels, reduce blood flow to the bone. 2. Steroid use, long term or high dose corticosteroids use is a significant risk factor, possibly due to fat buildup in blood vessels. 3. Alcoholism. Excessive alcohol intake leads to fat buildup in blood vessels, hindering circulation. 4. Blood disorders. Conditions like sickle cell anemia can obstruct blood flow, causing bone damage. 5. Medical conditions. Lupus, diabetes and other autoimmune disorders are linked to AVN. 6. Radiation therapy used to treat cancer. Radiation can weaken bone tissue. 7. Chemotherapy. Cancer treatment can reduce blood supply to bones. Risk factors. 1. Trauma, fractures or joint injuries. 2. Long-term corticosteroids use, a primary non-traumatic cause. 3. Alcohol consumption, heavy drinking increases risk. 4. Chronic conditions, disease like sickle cell anemia and lupus. 5. Radiation or chemotherapy, previous cancer treatments. 6. Organ transplant, use of immunosuppressants, drugs after a transplant can increase AVN risk. Complications. 1. Joint collapse. AVN can cause the bone to collapse, leading to joint destruction. 2. Osteoarthritis. Progressive joint damage can lead to osteoarthritis. 3. Loss of joint function. Mobility can be severely affected. Or chronic pain. Persistent pain can affect quality of life. Pathophysiology. AVN occurs when blood flow to a bone is interrupted or significantly reduced. Without proper blood supply, the bone cells die and the bone weakens. Over time, if untreated, the affected bone may collapse, particularly in weight-bearing areas like the hip. The body attempts to repair the damage by remodeling the dead bone, but this can lead to joint deformity and further complications. Here's a step-by-step breakdown of the pathophysiology. 1. Vascular insufficiency, initial events and occlusion of blood vessels. 2. Cellular hypoxia, lack of oxygen and nutrition, energy failure. 3. Cell death, necrosis, osteocyte death, bone marrow necrosis, structural breakdown. 4. Microfractures, bone weakens, inability to repair. 5. Subchondral collapse, weight bearing stress, bone collapse. 6. Cartilage damage, joint surface compromise, osteoarthritis. 7. Inflammation and pain, inflammatory response, pain and swelling. 8. Remodeling, attempted repair, body's repair attempt, ineffective repair. 9. Advanced joint destruction, progressive deterioration, including joint deformity, loss of joint function, severe and chronic pain, complete joint collapse in advanced stages. Understanding this process is key to diagnosing AVN early, as interventions like core decompression or other treatments can help restore blood flow and prevent irreversible bone damage if caught in the early stage. Signs and symptoms. 1. Pain. The initial symptom is often mild or intermittent pain in the affected joint, which worsen over time. 2. Limited range of motion, joint stiffness and reduced mobility. 3. Swelling. Inflammation may occur leading to visible swelling. 4. Limping, common if the hip or knee is affected due to pain and weakness. 5. Joint instability. As the bone collapses, joint function becomes compromised. Diagnosis. A. Medical history and physical exam. Review of symptoms, lifestyle factors and prior injuries or medical conditions. B. Imaging test. 1. X-rays, often used initially to assess bone changes. 2. MRI, most sensitive and definitive test to detect early stage of AVN. 3. CT scan provides detailed image of bone structure and damage. 4. Bone scan can help in identifying areas of reduced blood flow. Nursing diagnosis. 1. Acute pain related to bone tissue death and inflammation to impaired physical mobility related to joint damage and pain. 3. Risk for impaired skin integrity due to decreased mobility. 4. Risk for infection following surgical interventions. 5. Anxiety related to chronic pain and potential joint deformity. Management. A. Conservative treatment. 1. Medications, pain relievers, blood thinners and cholesterol lowering drugs to improve blood flow. 2. Physical therapy, strengthening exercises and mobility training to maintain joint function. 3. Rest and joint offloading, limiting weight bearing activities to prevent further damage. 4. Assistive devices, crutches or braces to reduce joint stress. B. Surgical treatment. 1. Core decompression, a surgical procedure to relieve pressure and create channels to stimulate blood flow. 2. Bone grafting replaces dead bone with healthy bone tissue from another area. 3. Osteotomy, reshaping the bone to reduce joint stress. 4. Joint replacement, total hip or knee replacement in severe cases. Treatment: 1. Medications, non-steroidal anti-inflammatory drugs, bisphosphonates to preserve bone density, and anticoagulants for improving blood flow. 2. Surgical interventions as maintained. Surgery may involve decompression, grafting or joint replacement. 3. Lifestyle modification, reducing alcohol intake, quitting smoking and weight management. Psychosocial medicine. 1. Emotional impact, chronic pain, immobility and potential disability can lead to anxiety, depression and social isolation. 2. Counseling, psychological support and therapy may be needed to patients dealing with long-term consequences of AVN. 3. Rehabilitation, focus on emotional support, adaptation to physical limitations and maintaining independence. Prevention: 1. Limited alcohol consumption, reduce the risk of blood vessel damage. 2. Avoid long-term corticosteroid use. Use the lowest effective dose if steroids are necessary. 3. Manage chronic diseases. Regular monitoring and treatment of conditions like sickle cell anemia, lupus can reduce the risk of AVN. 4. Exercise and weight management, maintaining joint health through regular physical activity. In conclusion, avascular necrosis is a serious condition that can cause joint dysfunction and severe disability if left untreated. Early diagnosis and interventions are critical to preserving bone health and joint function. Conservative management can be effective in early stages, but advanced cases often require surgical intervention. Preventing strategies including lifestyle modifications and managing underlying conditions can help reduce the risk of developing AVN. Addressing the psychosocial impact is also important for holistic care. Thank you. Have a nice day.